All right, we'll take you now to the 2016 International AIDS Conference in Durban, which comes to an end today. So it's been a packed week of formal proceedings, which have seen the likes of world leaders, policymakers, HIV workers and celebrities coming together to embolden the fight against the virus. Yesterday, Prince Harry and Elton John joined forces at the conference to highlight the work that still needs to be done in this fight. Prince Harry implored his generation to take up the leadership in the battle against HIV, just like his late mother, Princess Diana, did 25 years ago. So let's get more now from the conference. We're joined once again by our reporter, Ayanda Mhlongo. Ayanda, good afternoon. You've got something for us on some groundbreaking research, a new vaccine, the first of its kind. Tell us more.
Well, welcome and thank you for joining us once again from the 21st International AIDS Conference. It's day 5. It's the last day of this AIDS conference and certainly has been a momentous occasion for South Africa and for the world. Now, as the curtain closes on this conference, the question now is, where do we go from here? As the scientists, as the policymakers leave Durban today, people on the ground, people living with HIV, the civil society saying we want action. We want the discussions here. We want programs to be implemented on the ground. Now, for South Africa, we've certainly done very, very well with regards to access to treatment. 3.4 people now in South Africa are on ARVs. We've certainly also made progress in reducing the mother-to-child transmission. But one of the concerns has been the new infections. South Africa has now released its new strategic plan, and joining me now to discuss the way forward for our country is the Deputy Minister of Health, Dr. Joe Phaahla. Deputy Minister, thank you very much for joining us. Certainly it has been, and your colleague from Durban, MEC Dloma, has said it's been a successful conference. Now, moving forward, the concern is new infections. You've done well when it comes to treatment as a country. New infections, what is the program? What are we going to do?
Well, definitely that's the focus as we move from here. We need to stabilize in terms of making sure that the identified key populations get the services in terms of treatment, with the focus on stopping new infections. Now, throughout the conference, both in the plenary and in various breakaway sessions, there's been various inputs in terms of looking at what is available in terms of our possibility to eradicate HIV/AIDS by 2030. And with a focus on stopping new infections. Now, by identifying what is called the key populations, including, as you correctly said, young girls, adolescent girls and young women as a very important key population where the spread is happening, but also other key populations, your sex workers, your men who have sex with men, your drug, especially injectable drug users. The key issue here is how can we use what we have, what do we know, in terms of continuing to scale up using treatment, because currently what we have, it's the treatment, also as pre-exposure prophylaxis. How can we scale up and make sure that focusing on those key populations, make sure that, because treatment is also being confirmed as helping in terms of reducing transmission. When people are on continuous treatment with reduced viral loads, they also don't spread, but also in terms of the PrEP. So the issue here is, how do we make sure that we reach everybody who should be treated? Because it's not only in terms of increasing length of life expectancy by treating, but it also contributes towards reducing new infections, and also in terms of especially those who are still HIV negative, especially our young girls. What are the kind of interventions also, while we're looking at in the long distant future possibly vaccine, in terms of changing the lifestyle, and in terms of sexual debut, how can we increase those kind of awareness that we must not drop the ball in as far as sending those messages. Prevention, ABC remains very key, but also knowing that sometimes there are some gaps in that. How do we use the technology which is available in terms of the treatment also as a form of prevention? So that's really, and as many speakers emphasized, you know, we must not be complacent in as far as having increased the coverage. There's still gaps of people who are not yet covered. So they're really going forward. I believe all of us will be looking at those.
Minister, also there's been quite a strong representation from the LGBT community, yes. And you're speaking about the high-risk populations and them wanting more focus on them in access to healthcare. They are complaining that they are not being treated well in our healthcare facilities. So what are government programs to possibly train our healthcare nurses and our staff at our clinics, at our hospitals, so they better understand and are able to work with that community?
You know, social stereotypes are not easy, you know, to do away with. And, you know, we've come a long way in terms of, you know, the views of society about the LGBTI. So there's already a lot of work which has been done in terms of training, not just nurses, but the broader health, our health workers as a whole. So a lot more work still needs to be done. I mean, I was just listening on the radio earlier on one of your stations where somebody was actually saying that they came to a clinic, and at the clinic, and they did indicate that they were a gay, a lesbian. And then the nurse, instead of you know, going forward in terms of attending to the person, went to call other colleagues and wanted the patient, you know, the client to repeat what she had said, sort of now as a kind of a gossip. So those are some of the, still isolated, but there's still a lot of those stereotypes. So we do need to, you know, do a lot more in terms of training to make sure that across, you know, all our spectrum of our health workers, but also in the society, because the health workers are also just a reflection of attitudes in terms of our society. So a lot is still need to be done to make sure that those key populations do get quality service. Yeah.
And Minister, you also mentioned vaccine, and we know that the Medical Research Council, in fact, there's some interesting developments there. In November, we are set to start a new trial, and it's collaboration between South Africa and America. If you can just tell us about that.
Well, you know, we are all very optimistic. You know, as you know, here in South Africa, the Medical Research Council and our various institutions, Caprisa also based here in Durban, have done a lot of work. A lot of, you know, trials have been done on various, you know, forms of not just vaccine, but also various forms of prevention, especially focusing on women, because they are the major, you know, sufferers in terms of the transmission of HIV. So we're very optimistic. You know, it's cautiously optimistic, as it's often said, because that will be a major breakthrough. If indeed the trials which are going to be conducted on a larger scale can come out positive, it will take us onto another trajectory. And you know, so we're all, you know, really waiting with a lot of optimism that is going to come positive.
Minister, thank you very much for your time. Deputy Minister of Health, Dr. Joe Phaahla, just taking us through what we can expect from South Africa. South Africa has announced its new strategic plan on how it is going to continue the fight against HIV and AIDS. Well, day 5, we are almost wrapping up here in Durban. I just see some of the delegates around with their bags now, and you can now tell that very sadly for many people who've been so excited about being here during the course of the week, that the curtain is certainly closing on this conference. And basically now the world will be waiting for action, action, action. That is the call from people living with HIV. That is the call from civil society. And with that, it's back to Johannesburg.